Hello and welcome back to my channel. Today we're discussing polymyalgia rheumatica, a condition that primarily affects older adults and can cause significant pain and stiffness in the muscles. Despite being relatively common, polymyalgia rheumatica, or PMR, is often misunderstood or misdiagnosed. If you or a loved one have been experiencing sudden onset muscle pain and stiffness, particularly in the shoulders and hips, this video will provide essential information on symptoms, associated conditions, diagnosis, and management. Polymyalgia rheumatica is an inflammatory disorder that affects the muscles, making everyday activities such as getting out of bed, dressing, or lifting the arms challenging. The condition is most commonly seen in individuals over the age of 50, and its exact cause remains unknown. However, inflammation plays a significant role in its development. The good news is that PMR is highly treatable and most people respond well to appropriate management. In this video, we'll explore the symptoms of PMR, how it is diagnosed, conditions that may be associated with it, and the available treatment options. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Polymyalgia rheumatica is characterized by pain and stiffness, primarily affecting the shoulders, neck, upper arms, hips, and thighs. The symptoms often develop suddenly, sometimes overnight, and can be severe enough to interfere with daily activities. Unlike conditions that cause muscle weakness, PMR primarily leads to pain and stiffness without actual muscle damage. Morning stiffness is one of the hallmark symptoms of PMR. Many individuals report that their muscles feel stiff and achy upon waking, and this stiffness may be lasting more than an hour. The stiffness can gradually improve throughout the day with movement, but often worsens again after periods of inactivity. The pain associated with PMR is typically symmetrical, meaning it affects both sides of the body equally. It may start in the shoulders and then spread to the upper arms and neck. In some cases, the pain extends to the hips and thighs, making it difficult to perform tasks such as standing up from a seated position or climbing stairs. Fatigue is another common symptom of PMR. The body's inflammatory response can lead to overall tiredness and a feeling of being unwell. Some individuals may also experience a mild fever, unintended weight loss, or depression due to the persistent pain and stiffness. Unlike other inflammatory conditions, PMR does not cause swelling in the joints. Instead, the inflammation primarily affects the tissues surrounding the joints, such as the bursa and the tendons. This is why joint pain may be present, but swelling is usually minimal or absent. For many people, PMR symptoms can be mistaken for arthritis or other musculoskeletal conditions. However, the specific pattern of muscle pain and stiffness, along with its rapid onset, helps distinguish PMR from other disorders. One of the most important conditions associated with polymyalgia rheumatica is giant cell arteritis, also known as temporal arteritis. This is a serious inflammatory condition that affects the blood vessels, particularly the arteries in the head and neck. Giant cell arteritis can cause headaches, scalp tenderness, jaw pain when chewing, and vision problems. In some cases, it can lead to permanent vision loss if not treated promptly. Approximately 10 to 20% of people with PMR develop giant cell arteritis, and conversely, about 50% of individuals with giant cell arteritis also have PMR symptoms. Because of this connection, doctors closely monitor individuals with PMR for any signs of giant cell arteritis. If symptoms such as sudden vision changes, severe headache, or jaw pain occur, immediate medical attention is necessary. Other autoimmune conditions, such as rheumatoid arthritis or lupus, are sometimes considered when diagnosing PMR, but they have distinct features that set them apart. Unlike rheumatoid arthritis, PMR does not typically cause joint deformities or erosions seen on imaging studies. Additionally, PMR has been linked to slightly increased risk of cardiovascular disease due to the underlying inflammatory processes in the body. Proper management of inflammation is important not only for symptom relief, but also for reducing the risk of complications. There is no single test to definitively diagnose polymyalgia rheumatica, so doctors rely on a combination of clinical symptoms, laboratory tests, and imaging studies to make an accurate diagnosis. The first step in diagnosing PMR is a thorough medical history and physical examination. A doctor will ask about the onset, location, and severity of muscle pain and stiffness. The classic presentation of symmetrical shoulder and hip pain with prolonged morning stiffness raises suspicion for PMR. Blood tests play a key role in the diagnostic process. Inflammatory markers such as erythrocyte sedimentation rate, or ESR, and C-reactive protein, or CRP, are typically elevated in people with PMR. These markers indicate the presence of inflammation in the body, although they are not specific to PMR and can be elevated in other conditions as well. Additional blood tests may be performed to rule out other conditions. Rheumatoid factor and anticyclic citrullinated peptide, or anti-CCP, antibodies help distinguish PMR from rheumatoid arthritis. Thyroid function tests may be ordered to check for hypothyroidism, which can sometimes mimic PMR symptoms. Imaging studies, such as ultrasound or MRI, can be useful in certain cases. These tests can detect inflammation in the bursa and tendons around the shoulders and hips, which is common in PMR. If giant cell arteritis is suspected, a temporal artery biopsy or advanced imaging techniques like PET scans may be recommended. A key feature that supports a PMR diagnosis is a rapid and significant improvement in symptoms after starting corticosteroid treatment. If a patient experiences dramatic relief within days of taking low-dose steroids, it strongly suggests PMR rather than another inflammatory condition. The primary treatment for polymyalgia rheumatica is corticosteroids, specifically prednisone. Low-dose prednisone, usually starting at 10 to 20 milligrams per day, is highly effective in reducing pain and stiffness. Most patients experience significant relief within a few days of starting treatment. Corticosteroids work by reducing inflammation, but long-term use can lead to side effects such as osteoporosis, high blood pressure, weight gain, and an increased risk of infections. Because of these risks, the goal is to use the lowest effective dose for the shortest duration possible. Once symptoms are under control, the prednisone dose is gradually tapered over several months. This process must be done slowly to prevent symptom relapse. Some individuals may require long-term low-dose steroids to keep symptoms manageable. To minimize steroid-related side effects, doctors may recommend additional medications, such as bisphosphonates and calcium with vitamin D, to protect bone health. Regular monitoring of blood pressure, blood sugar, and cholesterol levels is also important. For individuals who struggle with tapering steroids or experience frequent relapses, steroid-sparing medications such as methotrexate may be considered. Methotrexate is an immunosuppressant that can help reduce the need for long-term steroid use. Lifestyle modifications also play a role in managing PMR. Regular physical activity, such as gentle stretching and low-impact exercises, can help maintain mobility and reduce stiffness. A healthy diet rich in anti-inflammatory foods, such as fruits, vegetables, and omega-3 fatty acids, can also support overall well-being. Because PMR can have significant impact on daily life, support from family, friends, and patient advocacy groups can be beneficial. Managing a chronic condition can be challenging, and having a strong support system can improve quality of life. Most people with PMR respond well to treatment, but the condition can last for several years. Some individuals achieve complete remission, while others may experience occasional flare-ups. Regular follow-up with a healthcare provider is essential to monitor symptoms and adjust treatment as needed. So, polymyalgia rheumatica is a common inflammatory disorder that primarily affects older adults. It causes significant pain and stiffness in the shoulders, hips, and neck, often leading to difficulty with daily activities. While the exact cause remains unknown, inflammation plays a major role in the condition. Giant cell arteritis is an important associated condition that requires close monitoring. Diagnosis is based on clinical symptoms, blood tests, and response to corticosteroid treatment. The good news is that PMR is highly treatable. Most people experience significant relief with low-dose steroids, although careful management is necessary to minimize side effects. Lifestyle changes and regular medical follow-ups can help improve long-term outcomes. Thank you for watching. As always, take care of yourself and make the most of your day.